Hello everyone!
Welcome back to our journey in Pemilihan Putra Putri Permira 2022.
My name is Wawan Irawan.
And me, Marini Wijaya.
We are students representative from
Yekaterinburg.
Okay, today we're gonna talking about mental health, especially the dangers of self-diagnosis.
Why is that important? To find out more,
Let's check it out!
According to WHO, World Health Organization, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community, while mental disorders are generally characterized by a combination of abnormal thoughts, perceptions, emotions, behavior, and relationships with the others.
in this modern era, information about anything can be obtained easily through the internet, including information about mental health. This causes many people to be tempted to find out for themselves the cause of the mental health symptoms they are experiencing through the internet, rather than going to the doctor.
Or it can be hard for many patients to find time to meet with their doctors. On top of that, doctors often feel rushed when speaking to patients. Shorter office visits, coupled with the risk in online search, mean patients can feel tempted to self-diagnose their symptoms through Dr. Google. This phenomenon is called self-diagnosis.
Self-diagnosis is diagnosis oneself with a disorder or disease based on self-knowledge or information obtained independently.
However, did you know that instead of being useful, self-diagnosis can actually harm your health and have a bad effect on your mental health?
And how to recognize the characteristics of self-diagnosis and how to overcome it. Have you ever felt that you were in an unhealthy condition mentally or feel depressed even though you had never consulted a psychiatrist? Be careful, you could doing a self-diagnosis. The dangers of self-diagnosis itself can eventually trigger the emergence of a fatal mental health condition. First, recognize the following characteristics of self-diagnosis.
First, panic. Self-diagnosis can trigger panic, which will then cause stress to someone. Those of you who do self-diagnosis also tend to experience various unnecessary panics. When doing self-diagnosis, it will be easier for someone to assume bad things, which then trigger various worries which are then unfounded. These conditions can ultimately trigger stress, which will have a bad effect on a person's mental condition.
Second characteristic, denying mental health. By doing self-diagnosis too often, you can also deny the real mental health conditions. Self-diagnosis itself actually makes you not understand exactly what various mental disasters or diseases you are actually experiencing. You are only guessing various possibilities that are not certain the truth, so that in the end, underestimate the various conditions that could be actually serious.
Third, don't want to consult with experts. By considering themselves as someone who is able to self-medicate, those who often carry out self-diagnosis, they don't want to consult experts anymore. People who often do self-diagnosis also often find various information from the results of searching the internet, after which they feel that they no longer need to consult a psychologist because they will think they have understood the various symptoms they have without having to ask for help from experts. The conditions will have triggered a trust issue for psychologists because they tend to trust the internet more than the diagnosis of the experts.
Why is self-diagnosis risky? Self-diagnosis implies that the individual understands the subtleties and nuances involved in a complicated mental health disorder. But mental health disorder comes in many different types that all require their own particular method of treatment. For example, people who suffer from mood swings may think they have bipolar disorder, but mood swing can be indicative of many different issues, including stress, hormonal imbalance, and a personal disorder, or another neurological problem.
A doctor or mental health professional will understand these subtleties and nuances so that patients can avoid a misdiagnosis. Self-diagnosis can also misdirect the doctor as well as the patient.
Why is a misdiagnosis dangerous? Patients who are misdiagnosed run the risk of trying medications or other therapies that can make their problem worse, or they can waste precious time on a treatment that does nothing for them. Depression that is left untreated can become more and more severe. With severe depressions, suicide is a risk, as well as psychosis, which can be distressing and potentially dangerous.
What is the biggest danger that can happen when someone tries to self-diagnose mental health conditions? One of the most dangerous risks when it comes to self-diagnosing a mental health condition is that the patient can mistake a serious physical condition for a mental disorder. Tourette's disorder and heart disease can mimic or produce depressive symptoms. When someone believes they have clinical depressions based on a devious self-diagnosis, they can miss an underlying heart conditions, which can lead to a heart attack, stroke, and death.
Also, sometimes cancerous brain tumors can cause people to experience psychological symptoms. If someone assumes they have depression and begin to treat that and only that, a brain tumor can continue to grow until it's too late to reverse the course of the disease. The ultimate risk people face when self-diagnosing any mental health disorder, not just depression, is permanent disability and death.
It's true that some people may not want conventional medical treatment for mental health conditions. Many patients can recover from their symptoms with therapy or deep brain stimulation techniques. But these patients may want conventional treatment for serious physical conditions like cancer or heart disease.
And here, 4 ways to solve self-diagnosis problems. After understanding the various characteristics, then how to overcome it, check out the following steps that can be taken to stop self-diagnosis.
First, avoid finding out disease through the internet. Please note that not all information on the internet is true, although it's not prohibited to find out the condition that you are experiencing through social media and the internet. This is not an effective treatment method. This can actually trigger errors in handling due to misdiagnosis.
Second, avoid online mental tests. Don't take mental tests too often online. Currently, there are many tests related to mental health conditions circulating on the internet. Avoid doing these tests because their credibility is very doubtful. In addition, online tests which are not widely found also do not specifically assess symptoms based only on a general description.
Third, don't use other mental disorder as a reference. Although similar, your condition with other people is not necessarily the same. Don't use other people's conditions as a reference. Often we find the same symptoms and conditions that are felt with someone we know are celebrities with mental health disorders. It should be noted that although similar, the condition of one person and another person is not necessarily the same.
The last, don't hesitate to go to a psychologist and psychiatrist. Going to psychiatrist doesn't necessarily mean someone is crazy. If you feel symptoms that are immeasurable and have disrupted your daily life, don't hesitate to immediately seek medical attention and consult with experts, because mental health is not something that can be handled alone.
In the conclusions, in a perfect world, health information would always be factual, accurate, and could give answers specific to everyone. But this isn't the case. Misleading and false information fill search results constantly, and it can be difficult to know what's true.
This makes it dangerous for those who try to take control of their health on their own. They could become stressed, try solving their problems themselves, or neglect that they need care entirely. This also makes it difficult for doctors to provide the necessary care.
So, that is the information about mental health, especially the dangers of self-diagnosis.
We recommend that if anyone feels unwell for a long time, avoid self-diagnosis and don't hesitate to go to the doctor.
It's okay not to be okay. Keep following our journey in Pemilihan Putra Putri Permira 2022
by following Instagram account Putra Putri Permira and Permira Official.
See you!